here at the 2022 U.S. Open, and I'm joined today by Dr. Shawn Anthony, who's an orthopedic sports medicine surgeon at Mount Sinai. And today we're going to talk about ACL injuries. So, Dr. Anthony, what is the ACL and what does it do?
The ACL is one of four ligaments in the knee that provide stability for the knee. Four ligaments are the ACL, anterior cruciate ligament, PCL, posterior cruciate ligament, MCL, and LCL. What the ACL does in the knee is provide front to back stability and rotational stability. So when you're running and then you start to make a pivot or a turn, it keeps your knee stable.
And are ACL injuries common in tennis?
ACL injuries are less common in tennis compared to other sports that involve more contact, such as football or soccer, but they do occur in about 1.8% of all tennis injuries.
And what are symptoms of an ACL injury?
The most common symptom of an ACL injury is sudden pain and hearing or feeling a popping sensation in the knee. This is often followed by pretty quick swelling of the knee joint and difficulty weight bearing and a sense of instability.
And so what should an athlete do if they feel like they have an ACL injury?
If you feel you have an acute ACL tear, the best thing is to stop playing, not trying to push through that pain or swelling in the knee, because that can lead to further damage of the cartilage, the meniscus, or other structures. It's important to seek medical care and get x-rays, MRI scans as needed to figure out exactly what happened.
And how are the tears treated?
Tears are treated depending on the size of the tear. There are partial tears that can sometimes be treated without surgery, with physical therapy and rehabilitation. Other tears are complete tears, and we recommend reconstruction, or there's a new novel technique of a repair technique where we can actually try to get the ACL to heal itself.
So I'm sure all athletes would love to avoid an ACL tear. How can they actually be prevented?
Some of the things that athletes can do to prevent ACL tears: one is always warming up prior to exercise or competition. Two, staying flexible, maintaining good strength, core, hip, lower leg strength, working on balance and proper jumping mechanics.
Great. Well, thank you so much, Dr. Anthony.